9 p.m. tonight in both metropolitan Melbourne and regional Victoria, and then we'll give you a sense of what the next couple of weeks looks like, and then of course we're happy to take any questions. There are 137 active cases of coronavirus in Victoria, with just 2 new cases since my update yesterday. One of those 2 is linked to a known outbreak. 1 case is under investigation. 4 cases were reclassified. There are 12 Victorians in hospital, and none of those 12, I'm pleased to say, are receiving intensive care. A total of 2,944,356 test results have been received since the beginning of the year. That is 18,546 results received since yesterday, which again was another day of around 18,500. Can I thank each and every one of those more than 18,500 Victorians who went and got tested the day before yesterday. We got their results back to them quickly. It is a massive part of us opening up, not just getting tested, but getting tested as soon as you register, as soon as you feel those coronavirus symptoms. Don't wait days. Within hours of registering those symptoms, it's really important to go and get tested. That's how we pull this thing up. That is a very impressive test number, and across the course of the week we've seen those numbers very high, and that does give us great confidence to be able to make the announcements we're making today, and we want to continue to see those numbers at that high level. So sincere thanks to each and every one of those 18,546 people. There are 11 healthcare workers who are active cases. The rolling average to 17 October in Metro Melbourne is 7.5 cases and 0.5 cases in regional Victoria. The mystery cases to the 15th of October, there are 15, all in Metro Melbourne. None of the 2 cases today are from regional Victoria, so that means there are just 7 active cases in regional Victoria, 4 from Mitchell Shire and 3 from Greater Shepparton, and that is steady. It's been those numbers roughly for the last 3 or 4 days. In terms of active cases in aged care, there are just 10 active cases in aged care. And that essentially is the numbers of the day that I needed to update you on. Victorians have done an amazing job over recent weeks and months. What it means is that as so many cities across the world head into what is going to be a deadly winter, we in Melbourne and across Victoria are well placed to have a COVID-safe summer and a COVID-normal 2021. Yes, these lockdowns have come with significant hurt and pain and damage, but this strategy is working and will continue to work. It's not so long ago that we had 725 cases and there was simply no way we could have a debate, a perfectly legitimate debate, about how to open, when to open, how to do that. That was just not an option available to any of us. But Victorians in every community and from every background, every circumstance, have stayed the course. And we just have a little longer to go, just a little longer to go in order to see off this second wave, to defeat this second wave, and then to find that normal and to begin the process of rebuilding, and not just repairing damage, but making sure that our state, individuals, families, communities, the economy is stronger than it's ever been. You've got to get the sequence right. You've got to fix the health problem first, and then you can move on to do the other important work. So today, with numbers low, and not just numbers, but the stories behind them being compelling stories of this virus being pulled up, I'm very pleased to make the following announcements. From 11:59 p.m. tonight, the following changes to restrictions will be made. There will be no time limit on leaving your home for exercise or for socialising. The travel distance from your home will move from 5 kilometres to 25 kilometres. Outdoor gatherings will increase to 10 people from 2 households. The following settings will be open, subject to, of course, COVID-safe conditions. Tennis, skate parks, golf. Hairdressers will be back open. Real estate auctions will occur with a maximum of 10 people, and commercial real estate inspections can occur. Outdoor pools can host 30 swimmers. Indoor pools can open up for one-on-one hydrotherapy with a health professional. The following will be allowed subject to conditions also: non-essential outdoor home maintenance, repairs, renovations, house painting can occur with a maximum of 5 workers. Solo or automated car washing and pool cleaning will be allowed. Mobile or home business pet grooming will be allowed. Outdoor photography will be allowed, and there will be a full return of allied health services. From 11:59 Sunday the 1st of November, the following changes will occur. The 4 reasons to leave home will be removed. A maximum of 2 people plus dependents once a day will be able to visit homes. Not a bubble, not an exclusive arrangement, but essentially one family, 2 adults and children, to your home once a day. No more often than that. Following will be open subject to conditions from midnight the 1st of November. Retail will open back up. Hospitality, a maximum of 20 people inside and 50 people outside, will reopen. Beauty and personal services will return. Contact sport for under 18-year-olds and non-contact for adults will recommence. A maximum of 20 people will be allowed for outdoor religious gatherings. A maximum of 10 people will be allowed at weddings, and a maximum of 20 mourners at funerals. Outdoor seated entertainment can host a maximum of 50 people, or 25% of the venue's fixed seat capacity. That is all Metro Melbourne today and in 2 weeks. I'm going to come back to the intervening weekend in just a moment. Now to move to regional Victoria, where numbers are lower, and regional Victorians, again, every regional Victorian, just like every Melburnian, but every regional Victorian can be proud that we've got the numbers low, we've opened up quite substantially, and we've kept those numbers low. And that should be a point of pride for every regional Victorian. And if you look at Kilmore, you look at Shepparton, the numbers of people who've come out and queued, some of them for hours, to get tested, as part of our public health response to keep their family and every family safe, it is a deeply, deeply impressive thing. And I thank them sincerely. From 11:59 tonight, 2 people plus dependents are allowed into the home. So that arrangement I just spoke about for Melbourne in a couple of weeks, that comes on. The bubble is gone. You can have as many different families visit you, but they can only be 2 adults and dependents at a time per day. Other changes with conditions, of course. Hospitality venues can increase their capacity to 70 people outside and 40 people inside, 4 groups of 10 instead of 2 groups of 10. Outdoor religious gatherings will increase to 20 people. Indoor pools are open for 18 and under, a maximum of 20 swimmers, and one-on-one hydrotherapy with health professionals will also be allowed. Libraries, toy libraries, they'll open again, a maximum of 20 people. Households can visit a care facility rather than one person at a time. From 11:59 p.m. Sunday the 1st of November, non-contact indoor physical recreation for under 18-year-olds, for instance dance classes, will be allowed again with a maximum of 20 people. Non-contact indoor community sport for under 18-year-olds with limits on spectators, that will be allowed again also. Can I now just quickly go to fire and flood preparedness, and then I want to say a little bit about next weekend, so the weekend between now and the 1st of November. If you live in regional Victoria, you can travel, if you have a property in regional Victoria and you want to travel to that property and you're in metropolitan Melbourne, to make it ready for either flood or fire, the usual activity that goes on each October, November every year, there will be a process in consultation with your local council from Wednesday next week to go and do those important works. It will be upon the issuance by your council of a fire prevention notice that legally requires you to go and do that work. This is not an invitation to go and have a couple of days in regional Victoria and essentially move into regional Victoria without due reason. It is where you have a fire prevention notice. That letter of support from your council will also, there will also be very clear instructions from both the Chief Health Officer and from Victoria Police that the restrictions that apply, the rules that apply in Melbourne will travel with you when you go to your fire-prone second property, second residence, whatever it might be, to make the necessary, do the necessary work, whether that be around flood, because we do have, the Bureau is forecasting significant rainfall activity throughout the next couple of months, or to make your property as fire safe as possible. I don't propose to go through much more detail about that. We will push out all of that information so that people have got that detail well ahead of Wednesday, but this has been an issue that's been raised consistently. We've listened, we've got a framework around it, but I stress again, it is not an invitation for people who really don't have fire clean-up to do or flood preparedness to use this as an opportunity to travel to regional Victoria. On that ring of steel and the border remains in place, and I have no changes to those arrangements. In fact, we are probably, well, it's fair to say we are strengthening that. There will be more checkpoints, more cars will be pulled over. We're able to take these steps in regional Victoria, like 40 people inside a pub, because it is a lower virus community than Melbourne. In Melbourne, we have to preciously guard that low virus status in regional Victoria, just as every regional Victorian does. That won't be there forever. We will have freedom of movement within our state when it is safe to do that. But that is not now. So we have to keep only those who need to and have a lawful reason to travel to regional Victoria can in fact do that. And if you don't have a lawful reason, you have a greater chance now than at any time that you will be pulled up and you will be asked why you are travelling to regional Victoria, and if you do not have a lawful reason, then there is a very substantial financial penalty, just under $5,000. We don't want to be issuing any of those fines. We want people in Melbourne to stay in Melbourne, follow the rules and get the numbers in Melbourne as low as they are in regional Victoria, and then we'll all be able to move freely around our state when it's safe and doesn't put at risk everything that we've been able to build as a community. Now, in terms of the intervening weekend, with case numbers this low, it moves less to be about numbers and is much more about the stories that sit behind those numbers. Is it a mystery case? So do we know where you got it from? How quickly did you get tested? How many people did you come into contact with while you were infectious before you and we knew that you had this virus? How contained is it? All of those quite qualitative things become just as important as the numbers on any given day. We are very confident that we, by the 1st of November, will be able to, almost as a default setting, proceed to open all the settings that I have listed today. However, if through the course of this week we see further low numbers and a sense of certainty in the stories and circumstances that sit behind each of those case numbers, there is an opportunity that we can bring forward the things that are scheduled for the 1st of November. The way that would work, rather than us assuming, the Chief Health Officer, myself, the Health Minister and many, many others, assuming that we know what will happen each day this week, we have to wait and see what happens each day this week. I hope, and we'll all be working very hard, and I ask Victorians to keep working very hard each day this week so that we can stand up here next Sunday and make further announcements that what is slated for the 1st of November can be brought forward. I hasten to add, it will not be on Sunday with immediate effect Sunday night. There would be a couple of days to make sure that venues, for instance, were COVID safe and COVID ready. At this stage, we've set out a timeline, some important things today, the balance of that third step in 2 weeks' time. But there is some optimism, a confidence even, that if things continue this week as they have the last 5 days, we may be able to bring that forward. I don't want to speculate any further than that, and it's on us. It's everyone across the state, particularly those in metropolitan Melbourne. If we continue to follow these rules, if we enjoy these freedoms but do it in a COVID-safe way, the things I've announced today, then there is every chance that we are able to bring that 1st of November deadline forward and find that next big step towards COVID, take that next big step towards COVID normal some days ahead of the 1st of November. Now, I know and understand that not everything everybody wanted is in the announcements I've made today. I just make this point. I've announced today what is safe. I've announced today what is safe but will not undermine the sacrifice, the hard work, the pain, the amazing efforts that Victorians have put in, and quite frankly, on an international scale, the quite amazing job that we as Victorians have done to drive these case numbers from more than 700 down to single figures for 5 days in a row. If we could do more today safely, of course we would. No rules, no restrictions will be on longer than they need to be. I know it's frustrating. I know there's a lot of pain out there in the community. But we need to, as a community, focus, as a state, we need to focus on the fact that yes, we have stayed apart, but at the same time, we have stuck together. We have looked out for each other. We have achieved quite amazing things. That is something to be optimistic about. We'll be able to take these steps because they are safe steps. You cannot run, you cannot sprint to COVID normal. You've got to do this in a measured, steady and safe way. That's what I'm announcing today. For those who are pleased, well, I'm pleased for you. For those who aren't, please understand this. These are not easy decisions to make. There is a lot at stake. And if we do too much, too fast, then we'll be where none of us ever want to be again. Doing this again. Back where we were. There's been a lot of pain. Now's the time. Now's the time to take these steps and make sure that we draw a line under 2020. And as other parts of the world are going into a deadly winter with lockdowns and restrictions that are heartbreaking, we can find a COVID-safe summer. We can build a COVID normal 2021. One final point from me before I ask Martin to add to my comments, or maybe the Chief Health Officer. I just want to just say a couple of things about the grand final. Now, the grand final is very different this year, very different for obvious reasons. And whilst I know that many people would normally spend time with family and friends to celebrate that day, whether their team's in the grand final or not, that's a big part of who we are. But your household and only the members of your household, that's how grand final day has to be. You can't have friends over into your home. You can't pretend that it's over because we all desperately want it to be. As important as that is, as in a cultural sense, in a very passionate way, for every single footy fan across our state, it's not worth risking all that we've done, all that we've built, all that we can do in just a few days' time by having gatherings that are unsafe. I do not have enough time today to explain and go through and give you case study after case study after case study of people who quite innocently have visited others in their home. A group of 10, a group of 15, a group of 20. At the start of the visit, there's one person with coronavirus. At the end of the visit, everyone's got it. And then they go back to their households and it spreads and spreads and spreads. We can't have that happen. We cannot have that happen. I'm appealing to people, as significant as the day is, it's got to be different. It has got to be different. The teams that are in that grand final have had, well, arguably the most difficult season ever. They've followed the rules. They've been in quarantine. They've had all sorts of different restrictions placed on them, and we need to do the same. It's not an ordinary grand final in every sense. If we want to take some steps soon thereafter, and certainly a week after, then we just can't be having people coming around to your house and socialising as if this was an ordinary year. It is not. It is not. And no barbecue with friends on that day or any day is worth giving everything we've built back and making sure that it counts for nothing. That's not our strategy, but I just wanted to call that out because I know it's a significant day for all of us. But this is a very different year indeed. Now, you've all got information. We're not going to sort of freestyle on different questions. If you've got questions, we'll follow them up. Some we'll be able to answer now. Others we may want to come back to you with precise wording, and there is a lead-in time, and that's really important. But I'm not sure who wants to go next. Martin, do you want to? I'll now throw to the Health Minister, and then perhaps the Chief Health Officer can add to his comments, and we can take any and all questions that you have.
Well, thanks, Premier. All Victorians have achieved a remarkable result over the last few months. Everyone who has dug deep and made extraordinary sacrifices and carried an extraordinary burden has allowed us to see the results of the last few months, from that record high of over 700 now down for consecutive days to single figures. These extraordinary efforts mean, as the Premier has indicated, that we're able to take some careful, measured but significant steps towards introducing a COVID-safe system for all Victorians. Currently, I just wanted to address what that meant for a few particular areas, particularly allied health professionals, give you an update on statewide testing, and just bring our regional communities up to date with the extraordinary efforts the Shepparton community have achieved over the last few days. The Premier indicated that allied health professionals who have done a very good job dealing with important cases under the current restrictions. We're grateful for the work they've done in providing that urgent care for those patients that they deal with who need it. As of tonight, for Metropolitan Melbourne, those allied health professionals who are currently on the permitted work premises list will be able to resume face-to-face routine care. That is so important when it comes to people with disabilities, people going through rehabilitation, and a whole range of other areas that those allied health professionals deal with. And I want to thank them for that work. We've seen the uptake in telehealth services right across Australia and indeed Victoria during the course of this pandemic, and we continue to encourage everyone who can use telehealth services to continue to do so. And when it comes to the allied health professionals, to wherever possible use those telehealth services as well. One-on-one hydrotherapy sessions, the Premier indicated as an important part of that clinical support, will also be able to be undertaken with clinical support as of tomorrow. Not at this stage for group hydrotherapy sessions, but as we see those restrictions ease, that will come in due course. We know that when it comes to the pillars that have allowed us to get to this point, that testing is such a critical part of the ability to get ahead of this wildly infectious virus and to allow us to get to the position that we've got to today. Testing is our eyes forward into where this virus is. We've seen testing rates that have been really significantly improved, testing regimes that have got better and better and better, and testing services that now are going to workplaces, high-risk workplaces, disability services, healthcare services, and furthermore, that we can bring testing to you if you're not able to get to one of the more than 200 testing centres that are now operating right across the state. And to just reflect on what that has meant. In the past fortnight, we have seen 194,971 Victorians tested. That's an average of 13,927 tests per day. And I want to thank all of those Victorians who have been tested for that effort. And just to reiterate, at the earliest possible time, with even the most mild of symptoms, people need to get tested. As we ease these restrictions, testing becomes even more important, not less important. And the qualitative measures that the Premier talked about and that the public health officials will rely on is informed by testing. So I cannot stress enough the need to get tested at the earliest times, in the quickest possible times, at the multitude of facilities that are now available is critical to allowing us the confidence to ease these restrictions in a sensible, careful and sustainable manner. I just want to update and give a shout out to the Shepparton community. Everyone knows Shepparton is a strong, diverse community, but the efforts that the Shepparton community have, in extraordinary circumstances, not of their making, have responded in the past few days, is a model of the kind of community leadership, community engagement and partnership with primary health networks that shows where outbreaks do occur, we can respond in a really timely and effective manner. As of yesterday, there were a further 283 tests taken in the Shepparton community, bringing to that number of 6,079 tests for the Goulburn Valley surrounding area. And as a result of that, we can still say that there are only those 3 initial positive cases in the Shepparton community. I want to thank those 6,079 people, but more importantly, I want to thank the many hundreds of people in the Shepparton community who are currently self-isolating under the rules of now not just the close contacts of the 3 positive cases, but the contacts of those close contacts. The contribution you are making to the safety of yourself, your family, and your wider community is extraordinary, and I thank you for it. And the fact that we are able to keep numbers low means that we are able, through a testing regime, through a contact tracing regime, throw the blanket wider and more comprehensively as to mapping where this virus is. So the contribution those 400 plus people in Shepparton are making right now is extraordinary, and it means that the wider Shepparton community and the wider Goulburn Valley community can increasingly go about their future in confidence in a COVID-safe manner. And just to finalise that, for the Shepparton community, testing continues to be available today. The details are available on the Department of Health and Human Services website, or indeed the Goulburn Valley Health Facebook site. But the main sites, I won't go through them all, they're pretty well known to the Shepparton community, but the main sites are the GV Health Acute Respiratory Clinic in Graham Street, which is open till 5:30 p.m, the Macintosh Centre at the Shep Showgrounds, which is open to 3 p.m. We would encourage people who have symptoms to go to the former, to go to the Graham Street clinic, and if you don't have symptoms, to go to the Showgrounds. There are a number of other centres available throughout Shepparton and Kyabram areas. They're pretty well known to people. I just want to thank the Shepparton community for the outstanding work they have done. It's been a model response. I can't overstate enough the importance of testing to give us the eyes and the ears and the early warnings as to how we can respond to this incredibly challenging global pandemic. Victorians have earned this restrictions being eased. There's more we can do, but we can only do that with the certainty and the protection of having the public health information, testing and responses in place. So thanks, Premier.
Just before I ask Brett to add to our comments, I just wanted to just make sure people are absolutely clear. The roadmap as outlined remains in place for those other steps and other developments that were foreshadowed for November and indeed beyond. That will be updated depending on whether we are able to take a step next weekend, probably for implementation in the early part of the following week, or whether it is in fact the 1st of November. We want to make sure that industry's got all the certainty that they need, but it is a little bit challenging until we have the data as it comes in each day this week. But the status of that is unchanged at this point, but we'll update that to reflect the decisions that we hopefully can make sooner than the 1st of November, but it will be almost certainly no later than the 1st of November when we take the steps that I have outlined today. On one final broader point, when numbers get this low, modelling becomes less useful. Because it's not assumptions that you are making. You can put real data in, the actuals take the place of the assumptions. Chance does become quite a significant part of this. So does someone who test positive, have they been going about their business for 3 or 4 days, or did they go and get tested as soon as they got symptoms? Those sorts of things. How all of that plays out is as much a qualitative and narrative exercise as it is a numbers exercise. If this trend continues, and we're confident that it will, throughout the course of this week and the next, we will be able to take those steps no later than the 1st of November. There is an opportunity to bring that forward, but it's on all of us. Do we, yes, avail ourselves of the greater freedoms that have been announced today? Do we do it safely? Do we do it in a COVID-safe way? Do we wear our masks? Do we follow the rules? They're changed rules, but they're rules that are still, they're no less important. than those that we've been living with for months and months. Arguably, they're even more important. But that framework around the roadmap well beyond the 1st of November, we'll update that in due course, and that'll be informed by further discussions in the context of the announcements we've made today with business and with lots of other stakeholders, just to be clear on what the status of that is. We know certainty is very important, but if there's one thing more important than that, it's safety. And you can only do what's safe. I can't predict what this week will hold. I have to wait and see what the data each day is, because that's what will make things possible, only if people stay the course. I now might ask the Chief Health Officer just to add to my comments, and then come back and take any and all questions.
Thank you, Premier. Can I just add my thanks to the Shepparton community? I've got mates in Shep. I know that they understand how much people surged in response to the call out for testing, how that had its own challenges, but they are rightly proud of the Shepparton community for how they've responded, and it has been a fantastic piece of reassurance, really, for how we can respond to individual cases in communities, how people can quarantine appropriately, and we can be absolutely sure that those cases are properly contained, and that there's a safe ring around any of those close contacts. That is an ideal response, and really it's a model for how it might occur for individual cases in Metro Melbourne going forward, or anywhere else in regional Victoria. We'll have those challenges, but if people respond in the way that the people of Shepparton and Kilmore and elsewhere have responded, then we'll do very well. The two cases today, one is linked to the known Hoppers Crossing outbreak, and the other one is preliminary linked to some North Metro cases. So that is reassuring. We don't appear to have mystery cases from today's two cases. But we do have another mystery case that has been settled. It's for postcode 3081. That's Heidelberg Heights, Heidelberg RGH, Heidelberg West and Belfield. Yesterday I spoke about Box Hill and surrounds having a mystery case. So that's really just to emphasise that there's at least another unidentified individual, potentially chains of transmission in those areas. And again, people with any symptoms at all should get tested straight away and should isolate after that. The interviews are indicating that people haven't been to those high-risk sites that are listed on the website, and it's not clear where they picked it up. It again points to the importance of wearing masks for all of those outdoor activities that you're involved in, whether it's food shopping or other essential business outside of your home, including meeting others with the new limits from midnight tonight. Thank you.
Very good. We're happy to take any questions you have.
The new 25 kilometre rule,
Yes.
is that only in place for the next 2 weeks, or does that persist beyond the 1st of November?
It's certainly in place at least until the 1st of November, and it may well be a feature beyond that. The exact orders may well have it on for the full 4 weeks. We normally do these things in that way. They're not actually time limited, to be honest. They're on until we take them off. But that's there. In answer to your question, it's at least until then, and I expect it will be there perhaps a little longer than that. Let me explain why. So we don't finish up with large numbers of people congregating in certain places. So we don't finish up with, for instance, some northern suburbs travelling all the way down to other suburbs where there's not been very much virus at all. We need to keep that in place. It's a measure. I can't attribute a percentage dividend or a percentage benefit in public health to it. It's one of a series of different measures. Not an easy call to make, but we think that is that's the right thing to do. It will limit movement, and it'll stop large groups of people, or certainly much larger than they'd otherwise be, groups of people congregating in some of those more well known and well understood places of great beauty, whether it be up in the Dandenongs or down in the Mornington Peninsula, so on and so forth. It's just about trying to keep people a little closer to home than they might otherwise be, and it'll be there only for so long as it serves a purpose.
How did you arrive at the 25 kilometre specifically?
Well, there were many different options. We didn't think that, for instance, 10 was really responding to some of the challenges that a radius limit puts on people. we think that people will be able to avail themselves of the things that matter most to them and the things that they should be safely able to access with 25Ks. It's one of those things where you just have to make a call, and I'm sure if some will want it to be 30, some might want it to be not on at all, but the moment it can be removed, it will be, but it does serve, just as the 5Ks, and I know that's been very challenging for people, very challenging, but it has served a purpose. It's just meant people are much closer to home, and if you're much closer to home, then there's many less people that you can interact with. That's many less opportunities for the virus to move between people. This thing hitches a ride, and the further you travel, the further you'll take it. But with these low numbers, we can go to 25Ks, and hopefully at some point soon, well, we can go even further than that.
Can you tell us who decided on the 25K?
Sorry?
Can you tell us who decided on
All of these decisions are based on public health advice. None of these decisions have been made without seeking the detailed advice from our public health team. There was a very lengthy meeting last night and many phone calls thereafter. We're doing what's safe. We're listening to the experts. The science is driving us. I freely admit it is very challenging to be able to attribute to each and every rule, each and every measure, a percentage dividend. So this counts for X or Y. It's got to be seen as a package. And the proof of that is the fact that we've gone from 725 cases to now 1, 2, 5 days in single digits. That means that the package of measures, as uncomfortable, as challenging as they've been, both jointly and severally, have delivered that, has absolutely delivered that. And just like travel to regional Victoria will be available at some point in the future when it's safe, the notion of limiting people and their movement beyond a certain radius, that'll come off too.
This might be one for Brett. Are we still aiming for the 5 and 5 benchmarks for retail and hospitality to reopen? Is that what we've got to hit?
No. What we're looking to do is to move, because the numbers are so low, it becomes, as I've said, much more qualitative. What we have to do is look at each case. Of course, we want less rather than more. We want to stay in single digits, but we've got to look behind each of those. And we've tried along the way to talk about, 5 was a target, but if you had 6 or 7, but you were confident that you knew where they were and they were well contained, you could still take that next step. What this is a recognition that modelling gets very challenging when these numbers get this low. That numbers are important, but what sits behind them is much more important when the numbers are this low. And rather than sticking to a number in a kind of absolute sense, the things that will drive us, and I think some of the material we've given you goes to this: how many people are getting tested, how quickly are they getting tested, and how many mystery cases are there. What's the story that sits behind every new case that comes to us? And that means that there'll be many hours of meetings every day between now and the weekend to see if we can bring things forward a little bit. And if that's not the case, then there'll be even more meetings all the way through. That qualitative understanding, not just how many, but how and when and where and how contained is it, that's where we now find ourselves. Because, for instance, if you're talking about percentages, today's 100% worse day than yesterday. Of course it isn't. We've got 2 cases, we had 1 case yesterday. So I think that makes the point. The numbers start to become less absolute once you get down to very, very low numbers.
Does that mean the 0 case threshold for the moves at the end of November is gone? Is it still been just a day-by-day approach rather than that 0 cases over 14 days to move then?
It would still be our aim, but I think what we've said, I said a week ago, maybe more, that as the numbers got very low, you do have to make that difficult judgment: could this be as good as it's going to get? And then make a proportionate decision. We've never been about keeping these things on for an indefinite period to reach a target that may or may not be achievable. You've got to get close to that. You've got to be within, in that you've got to be in that space more broadly, because there's not a lot of difference between, say, 3 and 5. There's a very big difference between 5 and 50. So it's not just the passage of time, because no one's enjoying this, and no one's enjoyed it even one day of it. But I think we're now close enough to what were projections based on assumptions. They're now real numbers based on them being put in every single day, that it can become a little more narrative, a little more qualitative. The absoluteness of those numbers kind of fades away a little bit. But that's not an invitation to not follow the rules. It's not an invitation to to have more mystery cases. We want less across the board. And if people sitting at home now listening to this, if there's one thing you can do, you've got to follow the rules just for these next couple of weeks and indeed beyond. But the really key thing as part of that, as soon as you register symptoms, please go and get tested. We will take care of you, your family, and every family, because we'll know that you've got it, and we can work with you to prevent you spreading it to others. That's how you contain the numbers. A positive test is not a bad thing. There's no shame, there's no stigma. The virus does not discriminate. We don't. No one does. We've got to get a health response around you, though, and make sure that you're not giving it to other people unknowingly. That's the absolute key. Get tested, and get tested fast.
Premier, you say that this is not so much about the numbers, but more the story behind the numbers. So, seeing as we don't have that yet, surely that means that Victoria's contact tracing is just not up to scratch for us to reopen. No,
it means no such thing at all. Have a look at Kilmore. Have a look at Shepparton. Have a look at Benalla. Have a look at Latrobe Valley. The list goes on and on. Our contact tracers are pulling this up. That's why we've got 3 cases in Shepparton. We've got, much smaller numbers in other outbreaks. They're not hundreds and hundreds of cases, which they could easily be. And I don't think it's fair to say that we don't have the narrative. We do have the narrative. What I'm saying to you is it becomes more important. We have the story behind each of these cases. And that's in some respects as important, and in some circumstances even more important than the actual numbers. 2 or 3, 5 that are contained, where one person had it, they isolated, the rest of their household isolated, but because of the wildly infectious nature of the virus, the other 4 members in the family got it. Those 5 cases are infinitely different to 5 cases, the source of which is not known to us, they're mysteries, or an outbreak where we only get the information we need late, for instance, and it's away, and it's dozens or hundreds of people that are infected. That's the point I'm making. Contact tracing has never been stronger. Can it be stronger again? Well, I don't think there's any great massive improvement that can be made, but we're looking for it every day. Every day we're looking for minutes, for hours, and we're also looking for the most accurate information to be given to us. We've had a couple of outbreaks in recent times where people haven't told us the truth. You don't get in trouble for telling the truth. It's like talking to your doctor. All we want is the coronavirus information. It's gold. It's absolute treasure. And if we get a complete picture, we can really pounce on this, and we can make sure that it only goes, perhaps as far as it's gone already. It doesn't go any further. That's the absolute key point.
But didn't Minister Foley say on Friday that the contact tracing software, the CRM, still hasn't expanded as far as it eventually will and needs to? Isn't that a factor?
No. We're very confident. You run systems side by side when you're building a new system. This is all upside. All of this is upside. So it's not a matter of us having to wait for that. That's not delaying these decisions. It's not influencing these decisions. It just means that we'll have we'll have the backup that comes from having a full end-to-end digital product, so that a public health team in Shepparton can see exactly the same data as a public health team in Frankston, or wherever it might be. So that's on track. That's going along well, and it does take some time, though. It does take some time to build it, and you've got to run old and new beside each other, because until the new one has proved itself, you can't put all your faith in it.
Premier, how is it that your advice is just so at odds with the advice of the federal government, the federal health minister, other doctors, other epidemiologists, mental health experts who are calling on businesses to reopen now? Well,
there'll be differences of opinion from time to time, but I'll put it to you, I'll be really clear, and to Minister Hunt and anybody else who has a view about these things. I don't accept that anybody has a more complete picture of what this virus is doing in Victoria than the Victorian Chief Health Officer, the Victorian Deputy Chief Health Officer, the Victorian Health Minister, and the Victorian Premier, and a cast of many hundreds of other experts and people who are dedicated to this task. With the greatest of respect to those who have a different view, they're entitled to have a view, but they're not entitled to assert that they have a more complete picture of where we were, where we've got to, and where we plan to stay. And that is low numbers that achieved low and stay low. There can be lots of different opinions But the group that you just listed, I think there are some political opinions in there, and I think there are some epidemiological opinions in there, and ultimately the call is for us to make, and we have to make that call. This is not a PhD thesis. It's not an academic exercise. It's real, and the stakes are high. And my position to the Victorian community is I'm not doing what's popular, I'm doing what's safe, because we don't want to be back here again.
Premier, on the original roadmap, this next step would get rid of the 5 kilometre rule, and there would be
Yes.
no travel restrictions. So why have you now put in place the 25 kilometre rule?
Because that's a public health advice, and it will assist us in greater certainty about less movement than would otherwise be the case.
So are you
that-
able to explain the science and data behind 25 kilometres?
No, I've already dealt with that. I think I dealt with that off the top, where I said to you that I can't attribute to that one measure a percentage public health dividend. It's a package of measures, and you're free to try and pick apart each and every part of the rules. And there's been a bit of that going on for quite some time. That's fine. That's fine.
Impact people's lives, so it's
Well, they
important
do
to
impact
have
people's
the
lives, but I tell you what they
understanding
and
of
I tell you what
why-
they also impact. They also impact 725 cases becoming 2. That's what they impact, and that means we've got opportunities that France doesn't have, most of the United States doesn't have, opportunities that England doesn't have. The list goes on and on. Victorians can be proud, optimistic, and more than hopeful. They can just look at the data and the stories that sit behind that data. This package of measures, with pain of course, and with consequences, has worked. I cannot attribute a percentage dividend to every single item in the package. That's the nature of how packages work. They're a package of different things, and they all contribute to delivering a strategy. And there's simply no getting around the fact that we've gone from 725 cases to 5 days in a row, the last 5 days, in single figures. And I think that's something Victorians should be proud of and optimistic about. And if we can move further next weekend, we will. If not, we will move the following weekend. And as others are going into a deadly COVID winter, we are building, every Victorian is building a COVID safe summer and a COVID normal 2021. And I think that's a deeply impressive thing.
Back to contact tracing, we've been able to drive down cases from 725
Yes.
to 2 in a shuttered economy in Melbourne, and also
Yes.
stage 3 restrictions in regional Victoria. I guess how assured can we be, and how assured are you that the contact tracing system that was highly successful in a lockdown economy will also be equally as successful in an open economy?
Challenges change. Obviously there's more movement, but I'm very confident that we have everything in place that we need in place, and there's a determination to make sure that we get on top of cases as quickly as possible. But I just say to every Victorian, it's got to be a partnership. It has to be a partnership. No contact tracing system anywhere in the world will be able to pull this virus up if people just flagrantly breach the rules. If they say, well, I want it to be over, so therefore I'm going to act like it is. If people work with us, then I think we can continue to see low case numbers, open up further, keep those numbers low. We're not looking for zero every single day. There will be outbreaks, there will be cases. The other way to look at it, you can, if you get tested, or if someone else gets tested and then that requires you to get tested, then you sit down and you have a long form interview with someone and you only tell half the story. And look, and to be honest, if people want to write a column tomorrow that I'm blaming people, well, go for your life, right? You can't tell us anything but the truth. If you've got a cash in hand job, you need to tell us that you've got a job that's not on the books. You've got to tell us that the ATO doesn't know. I'm not telling the ATO anything. We don't want to know. We're not going to take that action. If you've been to a country town, then you need to tell us you've been there. It's very simple. It's like talking to your doctor. It'll go no further, but it'll allow us to pull this up. It'll allow us to stop the spread of this virus.
Is that what happened in the case of the truck driver going to Shepparton?
No, but we have had cases where people have got a cash-in-hand employment arrangement. They've got a job where they're not on the books. And when asked, have you been to work? The answer is no. We always find out ultimately, but time is everything. We've also seen some people who, for whatever reason, they haven't given us the complete picture. I I'm just saying to people across the board, you don't get into trouble for telling the truth. But if you don't tell us the truth, it does get incredibly difficult for those contact tracers and others to do the important work.
We only have one chance at this we only have one chance at this in being able to
Yes.
have a COVID safe rest of our lives, basically. And we need
Yes.
to be absolutely aggressive in ring fencing outbreaks, testing, contact tracing,
Yes.
and also infection prevention control in high risk settings.
Yes.
How are you guaranteeing that all of those things are top notch and in place before we begin easing?
Well, Samaya, I can't guarantee that every person in every setting wears their mask appropriately. So let's not get into
There are government
guarantees.
systems that could be
Yeah, but let's
put in
not get into
place for
guarantees.
95.
We're talking, this thing's, it's a virus, right? And this is about people, individual people. You know, there's millions of us and we all make hundreds of choices every day. So that's hundreds of millions of choices that are made every single day. What I can say to you is that everyone's doing their very best, the systems are strong, and we wouldn't be taking these steps. The public health advice would not be that we can safely take these steps if it was not safe to do that, and if there wasn't an appropriate public health response. The point I'm making is that whether you're the person who's, you know, working shifts and no one knows, or whether you've been somewhere and maybe it's against the rules and you're having to think about whether you'll tell us or not, do that. The truth matters. That's the real treasure here. And also, similar examples, you know, when you're wearing your mask, you've got to wear your mask properly. If you're sick, you can't go to work. Grand final, fantastic day, important day, can't go to your mate's place. All these things are just as important as the team of health professionals, the systems, the different protocols and processes that we have in place in lots of different settings. Everyone's got a part to play is the point that I'm making.
I'm not asking though about, you know, the fallibility of humans or whether or not you can guarantee that everyone can follow the rules, because I think we all know that they can't. But I'm more asking around the systems, like how aggressive are we going to be for every single cluster and every single outbreak? Are we going to have N95 masks for every single health worker? Are we going to start looking at cohorting, and is that going to be a permanent feature of our hospital system?
Our
going forward?
infection prevention and control standards are in excess of the national standard. They are in excess of the national standard. If we can improve them even further and get even further ahead of what we're required to do, then of course we will. And Andrew Wilson, Safer Care Victoria and others are all working in a partnership with our health professionals and their unions at every single setting. In terms of the broader point, I'm confident that if everyone plays their part, all of us, then we will have an appropriate public health response on cohorting. So the notion of the case gets isolated, the close contact gets isolated, and their contact gets isolated. That is a feature now because numbers are low, and it will continue to be a feature. And that will mean, I apologise in advance, that means that there'll be many hundreds of people on any given day that will be in their home. After the day 3 test comes, some will be allowed to go. They'll be allowed to go back to normal. Others may get a negative result, and that will be confirmed that they need to stay in their home. But what those hundreds of people being locked down in their homes makes possible is hundreds of thousands of others being able to go about their business in whatever set of rules there are at that point in time. It is a feature of our response in recent weeks because you can only do it when the numbers are low. It's going to continue to be a feature, but it only, again, back to the point I was making, it's only possible if people do the right thing and if people stay in their home when they're asked to do that, if they do isolate. And that's why it's so impressive to see hundreds in Kilmore having done it, hundreds in Shepparton doing it right now, and indeed others that are linked up to cases in metro areas as well.
A couple of practical points. Do the four reasons to leave your house still apply, given you can go and get a haircut? And do you still need a work permit, given you can go and get a haircut?
No, that's a permitted reason. So you can leave your home to go and access that service. The service is available, so you can go and do that. Because we've taken time limits off, and there's 25, you'd have to get the haircut within 25 k's, but there's not a time limit. But there will be conditions in that barber shop or hair salon, and you'll need to obviously comply with them, and the person providing you with the service will need to comply with those also.
So there are still only 4 reasons to leave your house, and you do need a work permit?
Now, on the work permit issue, only permitted workers can go to work. So if you don't have a permit, then you're not a permitted worker. In terms of leaving your home, yes, there are still reasons that you can leave your home, but they are much broader than they've ever been. And that is to say, you can go for all the permitted purposes. The formal position will be in the next step, where there's a much greater freedom of movement. We're still encouraging people, if you're not doing one of these permitted things, then you should stay at home. It's not a good thing to be milling in groups just for the sake of it. But there are more options now, because you've got the ability to connect with others, provided it's a group of no more than 10. You've got an ability, that's outdoors, you've got an ability to go and access some more services that are open now that weren't, whether it's allied health or indeed going and getting a haircut, and you can go and play tennis or golf or whatever it is that you want to do. There'll always be rules in place though, and each of those activities will look a little different, and they need to. But as soon as we can get them as close to normal as possible, we will.
Sorry, just on the mandatory masks policy, we're the
Yes.
only state that has that. Is that still subject to sort of the daily review as all these other restrictions? And at what sort of threshold or point are you considering adjusting that or honing it to more specific areas and circumstances?
There's no change to mask policy today, and I'm not going to give you a date on when we may change the mask policy. If you look at Shepparton, there's a couple of things that have played a massive part there. And again, you can never be absolutely certain of this, right? You can only look at logic and try and paint the most complete picture. The fact that more than 6,000 people have got tested, that's been a really big part of it. The other thing, you can only deduce the fact the place is relatively open. There are still rules, but it's relatively open, certainly compared to Melbourne. The fact that masks are still mandatory there when you're out of your own home, I think that has almost certainly played a part in the fact that we've done 6,000 tests. We had positive people there, unbeknownst to them, moving around the community for quite a lengthy period of time, and we've got 3 cases. So masks work. They're not everything, but as some would suggest, they're not nothing either. They make a difference. Low cost, high benefit, which means they're here until we make an announcement that they aren't. And I know it's not pleasant, particularly as the weather gets warmer, but in the scheme of things, if you want all the things I've announced today, and if we want to take another step and then beyond that, further steps, masks do play an important part in that. They won't necessarily be here forever, but they'll be here for so long as they produce, I think, a pretty significant dividend. Again, I can't put an exact number on it, but I think it's playing a part, and it's kind of a cultural thing now. People are doing it, and I'd encourage people to keep doing it because it does play a big part.
Just on the border between the regions and Melbourne, can you rule out the Ring of Steel being in place for the rest of the year?
No, I wouldn't say that. What I'd say is that certainly there'll be increased compliance activity, more checkpoints, more cars being pulled over between now and the 1st of November, and I think for some time after then. But it'll only be there for so long as we have got those differences, if you like, that kind of, the science tells us Melbourne is different to the regions. We'll have that border down, that checkpoint's gone as soon as we can, but we're not in that position yet. And I think Shepparton shows you that, Shepparton and Kilmore show you that just this week. It does move really fast. And look, regardless of some of the stories that we all know about, the best construction, people can have this and just not know. Their symptoms can be so mild that they don't even think to get a test. And if they were allowed to freely move throughout every part of the state, well then, as I said before, the virus hitches a ride and you take it from your household to an entirely different community, and then it can go on and on from there. So the border is there in place, and it will be for a while longer, but as soon as it's no longer necessary, then we'll have that down and we'll have a situation where people can move more freely throughout the state.
So would it be your intention that people in Melbourne could travel to regional Victoria interstate for Christmas? Is that still your intention?
I'd like to have a situation by Christmas where people can travel much more freely. The borders with other states is a matter for other states, but we've seen some pretty positive signs there. And in terms of regional Victoria, then I'd like to think that we are able to have much more freedom of movement. Again, when you arrive wherever you're travelling to, there'll still be rules, because it's not a normal Christmas. It's got to be a COVID normal Christmas, but hopefully we can make some of those announcements once we have more data.
Kick in the guts to businesses who thought they might be able to reopen. Some say they won't be able to survive being closed for another 2 weeks. Why are you ignoring them?
Because I'm following the public health advice, and to do anything different is irresponsible, completely and utterly irresponsible. I don't offer that leadership. I'm doing what is right. I'm doing what is safe. Whether it be popular or not, well, that's for others to judge.
And have you run the numbers about how much this is going to cost, being closed for another 2 weeks?
There are processes. There'll be a budget delivered quite soon where we will outline what we're doing, what the nature of the damage we're trying to repair is. I've said this to you many times, and indeed to all of you, and I'll say it to every Victorian: you can't fix the economy and repair the damage that this virus has done to the economy until you deal with the virus. The notion that pinballing in and out of restrictions for all of next year is a good thing, I don't accept that. And we're doing everything we can to avoid that. And that's why we're making these announcements today, because they're safe. To go further than we've announced today is not safe. And to every person in business who is not pleased, well, these are not, no one's enjoying this. It's not like we have made a decision and we had all these perfectly equal options and we chose one rather than the other. No, that is not what we've done. That is not what we've done. We will get you open when it is safe to be open. For you, for your staff, for your customers, and for every single Victorian.
From what you flagged for the 1st of November, what's the chances of a limited crowd at the Melbourne Cup?
Well, I think there'll be some connections, so from a kind of employment point of view, but I've got no announcements to make about the Melbourne Cup today. The Racing Minister will have more to say about that soon.
Once the 4 reasons for leaving home no longer apply, does that mean people can go back to the office?
No. We will have, I think, as a feature for some time, if you can work from home, you must work from home.
People who work alone in an office as well?
Again, we're not announcing those things today. That's still some way off. If we can get people safely back in some circumstances, then yes. But I think the notion of working from home where you can do that will be a feature for a while longer yet. And look, we will rely upon workers and employers to work with us on that. And it gets back to some of the points we've been here before, I think, whether it's people congregating in stairwells, people lift wells, tea rooms, all of that sort of stuff, plus, of course, getting to and from work, public transport being crowded, much more normal than COVID normal, all of those things. It's very frustrating. We'd love to have people back as close to normal as possible, but some of those things are not really an option just now. They may, in some circumstances, be an option soon.
How long can the committed worker permit system last? When are you anticipating that'll end?
I think that changes dramatically once we have all of those industries back by no later than we believe than the 1st of November and potentially earlier than that. So those permits are relevant for so long as we've got some industries still closed. But once retail's open, once hospos open, once all those other sectors that are closed, once they can take that step, whether that be the 1st of November or some days before then those permits will not be needed. Permits to travel into regional Victoria, though, will still be an issue. But again, that's why I know it's frustrating. Not every question can be answered today because we've got to see how things unfold, and that'll all be in the context of other steps that we take, whether it be next weekend or the weekend after.
Gyms in regional Victoria, are they still a way of opening yet?
They are, sadly. This is a high-risk environment. That's not my opinion. That's not a matter that I've come up with. That's the international evidence. That's the public health advice. We've gone further in relation to outdoor, but it's a very challenging environment, and it's one of those things where no one's taking any joy out of that. But it is very difficult when something's just by its very nature. This is no disrespect or any reflection on the owner or the person who operates it, but when something is by its very nature in a really innate unsafe, because in the context of this virus, it's really hard to make it safe. You can't. It's kind of binary. There'll be a time though. There'll be a time when they can, and we're looking at that closely. But I just can't give them the news they want now because it wouldn't be safe to do that.
If the virus seeps into public housing towers again or high-risk industries like meatworks or distribution centres, how will you manage an outbreak or a cluster in those settings moving forward?
Well, it'll be on a case-by-case basis. But I would just say to you, we're very pleased to think that meatworks have been more recently operating at pretty close to their full capacity. They were operating at a reduced capacity before then, so they haven't stopped, they haven't closed down, they've remained open. And we've seen very few cases there. And that's a testament to workforce, to management, to our authorised officers and to the public health team who've put in place rigorous COVID-safe plans, and everyone's worked really hard to make sure that those COVID-safe rules are followed. They are high risk, they'll always be high risk, and that's why there's got to be, there'll be a maintenance of the structure that's in place there, those plans, for a very long time, ultimately, until we get a vaccine.
Public housing towers, though.
Oh, on public housing towers, look, that would always be, just as it was before, it would be based on a series of very difficult decisions that are guided by one thing and one thing only, and that is how do you keep greatest good for the greatest number, how do you keep people safe? And sometimes that means you've got to take very challenging steps. You've got to do some things that you'd much prefer not to. I think that we've got every chance with low case numbers, lower mystery cases than we've had pretty much at any period in the last 3, 4, 5 months. We've got every chance of keeping it out of those vulnerable areas, as well as lots of others. And there's a well-known list, whether it's disability facility settings or aged care or hospitals or wherever those high-risk settings are.
In the event that it gets into some of these places, though, what has the government sort of learnt from what happened with the Flemington and the North Melbourne towers, for example, and then created plans and protocols just in the event that it happens again?
Well, I think that there is a process going on into that, and I don't want to be cutting across that. But I will say this: by its very definition, you learn from shutting down 9 public housing towers because we've never done it before. Like, it's completely unique. You absolutely learn from it because you've never done it. It is a one-off event. I hope we don't have to ever do that again. But we can't rule out, and in fact, I'll be clear with everyone: there will be appropriate, and they will be aggressive in their nature. There will be appropriate public health responses to any and all cases, any and all outbreaks, and that's the only way it can be, because we're not looking for zero forever. We're not looking to eliminate it. We're going to have it bubbling at some level or another in the community until we get a vaccine. So to have the place as open as possible for those who've got it, we will need their cooperation and we will need their support. For them, their contacts, and their contacts' to stay at home for a period of time, at least until we get that day 3 test or testing in the early stages. Things can change. We've seen that in terms of people then being allowed to go back to something approaching normal. We're very grateful to all those people. It's a much more aggressive and, if you like, targeted approach, made possible by the broad approach that we've taken to drive the numbers down low. But it's going to be a feature in lots of different ways. Laurel's been waiting for a while. Laurel.
Do you anticipate much more rigorous and more common workplace testing and developing the rapid tests as well?
Yes.
So I imagine, as alluding to what Samaya said before, as we go back into the workforce, people who've been out of work for 7, 8, 9 weeks and starting to feel a symptom are going to be much more reluctant to take that day off, aren't they? So how do you then... So
what we've got, and we'll get you a full breakdown because it's a couple of weeks ago we announced it, so it may have kicked up to another percentage, but we had, in a number of settings, we were doing 25% a week, so we get to half every fortnight, the full workforce over the course of a month. That's well and truly underway, so that's happening in meatworks, distribution centres, there's a framework in aged care as well, all those sorts of things, health settings as well. We'll get you an update on that. That is a feature, and it's going to continue to be a feature. So that does three things. It tells you whether there's anyone who's got it in the workplace. Why is that important? Well, because they're high risk, and if one's got it, the whole place will get it. But it also, I think, gives us an opportunity to be in that workplace and to be discussing each week, each fortnight, each month, the need to be vigilant around COVID-safe planning, the need to, even if it fades to very, very low levels, it's still here, it's still with us, and you've got to be vigilant about that. So no one at any point till a vaccine will be able to go to work if they're sick. That's just the nature of this. And if they do, they potentially cause very big problems for all of us And that's why there's a $450 payment while you wait for your test result, and it's why there's a $1,500 payment if you're positive and you have to not go to work, and you don't have sick leave to fall back on. And we've made a lot of those payments because insecure work is a feature of modern life, not a very good feature of modern life, but it's there, and those payments will remain. People will remain eligible for those until we finish up with the ultimate fix to this, and that's when a vaccine is developed, produced and available.
I guess testing a worker once a month, though, isn't that regular for those? Are there plans to ramp that up?
Well, it's stepping up. This is more than many other parts of the world or I think other parts of Australia are doing. We're doing a quarter in some workplaces every week. So every fortnight we've got half the workforce done. That also, I think, creates a culture where I think, to your very first comment, Laurel, will it be less likely that people, having been away from work for a long time, will go to work, or will stay at home if they feel unwell? Well, in high risk industries, the fact that we're in there testing people each day, each week, each fortnight, each month, I think that'll just be a constant reminder to people that you just can't be there. There are alternative sources of income. We'll look after you. We'll take care of you. You just can't go to work if you've got a sniffle, a scratchy throat, a headache, loss of smell or taste, fever, all those well understood coronavirus symptoms. You cannot go to work. We will look after you. If you've got those symptoms, there's no coughs and colds, there's no flu around. It's almost certain that you've got this, and you have to act and assume that you have. I'm confident we've got more surveillance testing, if you like, more sentinel testing going on, and it will ramp up. The plan had it going from 25 to 50%, all those things. I don't have that in front of me, but I'm more than happy to get it, because it's probably jumped to a higher level than when we announced it.
People are already querying whether or not the public holiday should be moved to a time not long after when we'll be able to go out and do things. Is that a possibility?
I don't have any announcements to make about the public holiday today. I'm sure that no matter when that public holiday was celebrated, it's going to be a different public holiday than it would otherwise be, because we're in the midst of a global pandemic and we don't have a vaccine for it.
Obviously, Swan Street in recent years has been pretty wild after grand finals with Richmond's success. Is there any other planning around enforcement activities to actually keep people home? Obviously, you won't have them at the ground pubs, but...
Yes, there is, and I'll let Victoria Police speak to that throughout the course of the week. I know people are very passionate about football, and they're very passionate about their team, and both Richmond and Geelong supporters will be very up and about this week, but it is not an ordinary grand final. It has not been an ordinary season. Those two teams, arguably, as Victorian clubs, have been through more difficulty than other teams across the AFL, and it's a testament that they've been able to make it this far, and they've been following the rules. That's one of the reasons that they've made it to the grand final. It's one of the reasons why Gill and all of his team and all the clubs have been able to have something approaching a footy season this year, albeit it's been very different. You just can't be going around to your friend's place and having a normal grand final Saturday because you desperately want that. I know people want that, but that is not safe, and it will do nothing but set us back. It'll make it harder for us to take these next steps, and it's just not worth it. It's just not worth it. So I'm appealing to people. We're so close. Let's not any of us do anything that puts at risk the really significant progress that we've made and the significant steps that we've taken today and that we hope to take about a week after that, maybe a little bit longer than that.
Premier, your 25-kilometre radius takes in regional Victoria. I assume that the metro rules...
No, it only applies in metro Melbourne.
But if it was to get into regional, your kilometres...
You can only go you can only cross that threshold, go past through that border, if you've got a lawful reason to do that. Now, on Little River, this has been an issue, and I think we've got a fix for that. It's a very small number of people that are just on the wrong side. Well, I shouldn't say that. They're on the wrong side of the line that we've drawn. We're going to try and unify that community and make sure that they've got some of those issues are dealt with. It's a very small number of people, and we don't think it presents a public health risk.
Is there any grand finals and plan going forward for church services?
I'll certainly try. Although I think Minister Foley's taken my notes, so maybe he can talk about that. I'll let him do that. It is outdoor services. They need to be proximate to a place of worship. There will be a COVID-safe plan, and for everyone at home, that's about a 40-page document that's written in. They're not my notes. I can't read that. Anyway, we will get you the detailed answer. Do you have the large print format? That's fine. We'll come back to you with the detailed notes, but we will see in regional Victoria the numbers increase, and we will see the introduction of those services at a higher level here in Melbourne. And I do want to make the point that this has, we are a secular state, or a secular nation, but faith is precious to so many people. And for those who have the gift of faith, those who are part of the regular worship and celebration of those core values and the things that are so important to them, this has been an extraordinarily difficult year. And whether I'm talking to the Archbishop or rabbis or imams, people, it's been a big gap. It's been a yearning. This is not everything that those faith leaders wanted, but it's substantial progress. And I'm really pleased that we've been able to do this. And regional Victoria will be a little bit ahead of Metro Melbourne, but they'll both align at some point. The outdoor nature is really, it's a kind of it's an unavoidable, just given, this is not a licensed venue, it's not a regulated industry, it's not an industry at all. I'm confident that they'll all do the right thing and they all want to desperately get back to something approaching normal. These are cautious steps, but they are steps forward.
Are you also going to just clarify the rules for outdoor exercise? So if 10 people can gather outside now, can 10 gather for outdoor exercise, cycling, golf?
Well, there'll be rules, I think, for things like golf and tennis. The 25Ks basically is in place. People need to be from no more than 2 households. So all of the rules that would apply for sitting and having a picnic in the park will finish up applying for all those other activities as well. Although, give you the golf example, I'm a bit more familiar with that than cycling. If there's a specific cycling issue, we can come back to you on that. But golf's normally played in 4s. I don't think it'll be played in 4s. I think it might be played in less than that. There's usually some equipment that's shared, rakes in bunkers and things like that. I don't think that'll be the case. So there'll be different steps in different settings to try and make those as safe as possible. And for instance, the clubhouse at the tennis club or the golf club will not be open. It's an outdoor activity. It's a playing field that you're getting access to. I've already had a conversation with Golf Australia. That I think just as one example, I think there'll be all sorts of protocols, but they won't want every member to turn up on the one day. They'll have to bring some order to that and try to space it out, if you like. On cycling, I don't know whether Martin wants to add to that. No, we'll come back to you on that.
Can I just go back to the grand final and regional centres? Will the government consider holding official grand final day events so they can monitor, social distancing and have a bit more of an atmospheric event?
Well, obviously, regional pubs, bars, restaurants, cafes, they will be, because I've made announcements today, so from midnight tonight they go to 40 and 60. That's really important. 70 I think it is, but certainly 40. The main one is the inside. That is a very substantial step forward. So that gives people a place to go other than to a person's home. They also have available to them by this weekend also the notion of not just a bubble that's exclusive with one other family, but they can have 2 adults and their children come to them. So grand final is going to be different in regional Victoria because the virus is different there. As this is a bit challenging. We had a bit of a chat about this, or we have over recent days. You can think of other times when, if it was not a normal year, but we still wanted to try and have gatherings, we might do live sites, for instance, and things like that. But we've got to be very careful that we don't actually encourage large crowds forming, because we know that that's not safe. So that's not settled, but I think the difference in settings in regional Victoria, I think, will mean there are more options. Melbourne, I know it's not what footy fans want to hear, but you just can't have people over for the grand final or any other reason until we take that further step.
Touch wants you to release the correspondence relating to your position on the passengers arriving from New Zealand. He thinks those emails will clearly show that you authorised, or Victoria authorised the people to come there. Will you release any correspondence?
I'm happy to release the numerous letters I've sent to the Prime Minister, and they say no such thing. It'd be just easier if Mr Tudge just accepted the fact that we were asked, do you want to be in the bubble? And we said no. And then, and I will get my notes back, Martin, because it's important. No, actually, I do have them here, thank you. You know how yesterday I said there were 17? It turned out there's 55 that have turned up from New Zealand. So this is gold standard, apparently, according to the federal government. Gold standard, a term that's been used quite a bit. We have been able to find 23 of those at 16 addresses. We are still working to find the balance. We got given a list 12 hours after they arrived. That's gold standard, apparently. We're having to find these people. We get a phone number, and we get this list of who's here, right? We're ringing them. One of them was in Byron Bay, and yet we were told they'd landed and travelled to Melbourne. Like, seriously, my advice to Minister Tudge is, instead of stubbornly defending this, work with us and let's make sure Victoria is not part of a bubble that we never agreed to be in. Now, if that's not possible, well then let's talk about what else can happen. I don't want to shut our border, but he should have a conversation with his boss. He should have a conversation with the Prime Minister, who I've lost count of the number of times he said to me, thank you for not closing your border. And we want to get all the borders open. I want that too. But we can't have people just wandering into the place from another country. It's New Zealand today. Who knows what the next bubble is with? Who that's with? You know, we've got authorised officers at the airport now because this has happened. We didn't think it would happen, but it has happened. We're going to follow up as much as we can. But I don't control the borders, and I don't control what happens at Sydney Airport, and I don't think anyone can reasonably expect me to. So I'm not looking for a quarrel on this. I just want it fixed. And if this is the best we can do, that people may finish up coming here because no one's got the power or authority to stop them, fine. Let's all work together. Let's get the best information as quickly as possible. Let's have a perfectly respectful conversation with people once they arrive in Melbourne. That's what we're doing now. Let's make sure, masks, all these rules. How's someone from New Zealand to know what all these rules are?
But how's someone from Sydney to know? What's the difference? There's more cases in Sydney than there are in New Zealand, so what's the problem?
Yes, but Lundy, they can't go into WA because the borders are shut.
Neither can we.
No, they can't go to Queensland because the borders are shut. So the very fact that we've done what the Prime Minister wants us to do and keep our border open, then we get asked, do you want to be in the New Zealand bubble? And we say no. And now we find ourselves, we are. So we'd actually be better off if we'd done what the federal government has criticised every day and twice on Sundays for months, close our border. I don't want to do that. This is fixable, but at the end of the day, instead of just saying, righto, this is not ideal, let's all work together to fix it, we've got all these federal ministers out there saying somehow it's my fault that people... I've got a bit on at the moment, right? But apparently I should add to what I do, monitoring every single person at Sydney Airport. Like, come on. Like, we've got a bit to get on with here. International borders are not the responsibility of the state government, and what happens in Sydney is not the responsibility of the state, our state government. Let's just all work together to get this right. But until there's an acknowledgement that something's gone wrong here, and I'm not interested in blame, let's just fix it. But emails and all this at 20 paces, that's not going to fix it. Anyway.
It's still not clear what needs to be fixed, Premier, what the harm is. I mean...
Well, no, there's a significant harm.
You're conflating arrivals from New Zealand with arrivals from elsewhere who need to quarantine in hotels still in Sydney.
But hang on, this is the thing. We made it clear that we don't want international arrivals, regardless of what country they come from, into our state, unless they quarantine.
Not at Melbourne Airport,
no.
Well,
yeah, indeed. But if you're, do you want to be in the bubble? Answer, no. And yet, we are.
So if I'm a Melburnian...
Because we've got 55 people here. I think it's 55. One of them's in Byron Bay, even though we were told they got on a plane and come to Melbourne.
That's an administrative issue, not whether...
The whole thing's an administrative issue. The whole thing's an administrative issue.
I guess the issue is, what's the difference between someone coming from Dubai, doing their 2 weeks quarantine in Sydney, then getting on a Jetstar flight to Melbourne? They've met the entry requirements.
Yes.
To somebody who comes from New Zealand, meets the entry requirements, so is allowed not to quarantine, getting on the same flight to Melbourne. What's the difference?
Well, we would know about the Dubai person.
Why? How? If they've done their 2 weeks quarantine...
If they've done 2 weeks quarantine, then they've done 2 weeks quarantine.
So they've met the entry requirements by doing that.
But hang on, Lundy, what you're asking me to forget, or just to sort of, for the sake of politeness, is that we were, if none of this matters, why were we asked, do you want to be in the bubble?
Is that because you're opening Tullamarine to international
No,
arrivals?
no. We said, well, we may finish up having to do that for the purposes of flights from New Zealand. That may be a better way to regulate this than being captive to whatever happens at an airport in another state. So that's on the table. I'd do that before I close the border. Now, this has become a quarrel because people in the federal government refuse to accept that this is not what we agreed to. I'm not interested in a quarrel. I just want it fixed. And if they're going to come, and they're safe, and we're not alleging that they aren't safe, Lundy, but frankly, if you've got people in Victoria can't move around their own state, yet people can come from Auckland and move around without a briefing, have a freedom of movement, as it were, that actual Victorians don't have.
But that's a political problem, not a COVID problem.
Well, no, absolutely not. Absolutely not. What do you think the chances of people who've come from another country and have made their way to Victoria, unbeknownst to us, right, observing all the rules that we have here? I think it's not unreasonable to say perhaps less.
So is everyone from Hume and Albury been given instructions on our...
Well, of course they are.
What are people landing from Queensland? Are they getting an info sheet when their plane lands saying these are the rules?
Well, there's not very many of them, and we know that they're coming. This is the thing is this.
It's the same.
The thing, no, but it's not the same. It involves aviation, so I always knew I was going to get into trouble with you, Lundy. But at the end of the day, we were asked a question: do you want to be part of this? We said no. We've found ourselves part of it without having agreed to it. Let's all just work together and make sure that what's safe, what's known and got some structure. I think that's the most important thing. We will make sure that everyone who comes here now has got all the information they need. But I would just say it does get a little challenging when we don't get advice as to where these people have come from or where they might be expected to be found for many hours after we ask for it. Let's just focus on fixing it. But
So what happens to the 23 people who you found? Do they get booted out of Victoria now?
No. We have a conversation with them and we make sure that they know what the rules are, and it's a kind of a welfare check in many respects. Are you healthy? Do you know what the rules are? Here are all the rules, and then we go from that. We've got no power to be sending people home. It doesn't have to come to that. But to say that people were quite surprised that we found ourselves in this bubble, despite the fact we'd said we would not be, would be an understatement. That's happened now. Let's just make sure that things are better and there's perhaps a greater flow of information, and whether it's administrative or whatever, I'm not interested in a fight. It's not unreasonable though for us to say, look, if people are coming to our state, we'd like to know, when, we'd like to have a heads up about that, we'd like to have that in accordance with the question that was asked of us and the answer that we gave. And I think we'll get there.
Just to clarify Victoria's position on this, the press conference here on October 3rd, Professor Sutton was asked about the travel bubble and said, I don't know that we have missed out. New Zealanders are free to come to Victoria. The question is what the requirements are on arrival.
Exactly.
The travel bubble, as I understand, is that there is no quarantine requirement. Victoria is open. So can we just clarify how, if New Zealanders are free to come here, how has it got to a point where...
but they're not free to come here. That was a broad statement long before the bubble was settled, and long before the
point where the bubble arrangement...
hang on. That's long before. I believe I can get you the exact date, but that's certainly before, whether it's long before or not. But it's before the Prime Minister wrote to me, and I'm not finding fault with the PM, but a comment was put to me by a federal minister. But the PM wrote to me, "Do you want to be part of this?" And I said, "Yes, but not now. There'll be a time we want to be. Of course we do." And hopefully we get the reciprocal arrangement and Australians can go to New Zealand. Although I'd be commending to all Victorians to stay in Victoria and spend up big in Victoria rather than going to New Zealand. This is fixable. I'm sure it will be. But until there's some acknowledgement, I think, that this is not ideal, it'll be hard to fix. But I'm confident we'll get this. We'll get this fixed.
In place. What happened when Professor Sutton was at the meetings on Monday and Tuesday where this issue was discussed?
Well, apparently it was discussed. I just remind you that the AHPPC, nobody voted for anyone at AHPPC. They provide advice. They're not politicians. They have no executive authority. And if that's now the standard, that national policy set by the fact that it was talked about at a meeting, that'll make that'll make things rather challenging, I think. Again, this has happened. These people are here. It's not about anything other than the fact that the first we knew of it was when they turned up. Then we started asking questions, and we said, well, look, give us their names. We'll get onto them and have a chat to them. That took a while, quite a while, and then it turned out that some of the information, and maybe it's not Border Force's fault. Maybe the person wrote the wrong thing on the card. I don't know, but we certainly, we asked for that on Friday night. We got it lunchtime Saturday, I think. In any event, we can't change what's happened. The point I'm making is that it's not unreasonable for all of us, all governments, at all levels, to have, and all agencies, just to have a clear picture on who's coming, so that we can engage with them.
Professor Sutton, the Kilmore and District Hospitals just posted that a staff member at Kemp's Bakery in Kilmore has tested positive to COVID. Are you aware of that? I guess it would be linked to that Kilmore cluster.
No, I presume that's just come through the team now.
They posted the last an hour ago.
There you go. So that'll be investigated. Obviously, there's a link in Kilmore. We'll need to look at whatever connections might be made with the known positive cases in Kilmore. That bakery, no doubt, will be shut. No doubt, contacts will be quarantining as a result.
Is that a surprise? Did you think that cluster was fully contained?
Oh, I think we were pretty confident that we'd looked extremely hard for anyone who had contact with that cafe and all of those who'd tested positive in Kilmore. So yes, it's surprising. Again, we need to keep prompting people to test more broadly if they're symptomatic at all. So we'll follow up accordingly.
Professor, you mentioned that there was a mystery case in Box Hill. There was obviously an outbreak at the Box Hill Hospital very recently. Have you been able to determine where that outbreak originated from?
No, not clearly. I mean, we've worked out some of the connections between households and Box Hill Hospital, but how it was introduced and who the index case was in that outbreak isn't clear yet.
We don't know if it's a staff member or if it's a patient.
No, we don't know. We don't know the index case.
And is there any chance that we can ever find out?
Well, I think we're always looking. Sometimes the genomics again tells us that it's related to something that we've known about, and we can go back and re-interrogate all the individuals as to whether their connections have any relationship to those sites or settings.
Just on community transmission, a week ago Alan Cheng was here saying the thing he's worried about most is community transmission. The numbers really haven't come down that far since then. Why are you confident and comfortable now about opening up, given there hasn't been much shift in the numbers?
Well, I think clearly the total case numbers every day are coming down, and significantly just in the last few days as those outbreaks have come under control. And as total numbers come down, I expect that will show in the community transmission cases as well, or the mystery cases. We've got a panel review in a few minutes. I'll need to leave on all of our mystery cases in the last 14 days. They go through an individual review process, but Alan and I want to look at each and every one of those. There might be some that get knocked off because of the review of pathology and epidemiology and everything else in relation to those cases. So I think those numbers will drop over time, but clearly they plateaued for a while there.
Just in terms of opening up, are you nervous when you make these decisions about today?
Oh, they're high stakes decisions, absolutely. I can never be complacent about them, and we're precautionary about them, but we're all on tenterhooks about how you manage each and every single case, knowing what the potential is. When sometimes the transmission is not in an easily controlled setting. So yeah, we remain nervous, but I'm confident we're going in the right direction. It's really clear that we've gone in the right direction for several weeks.
What do you need to see to be happy to allow people from multiple households gathering in private homes?
Look, we'll come to that when we come to it. I think we're talking about the next couple of weeks now. But we go through that review process over the next couple of weeks to see what's allowable in terms of multiple households and meeting indoors.
Ideally, no community transmission cases, no mystery cases.
Oh, ideally, but again, we wouldn't have that as some absolute threshold.
Professor, just on the AHPCC meeting where the arriving New Zealanders were discussed, you said you weren't there, and it now appears that you were there. how did that slip your mind, I guess?
I was not there for the beginning, and I was not there for that part of the conversation that was referenced yesterday. I think I was in at the 45-minute mark or thereabouts. I checked with the Secretariat support that we have at state level, so I wasn't there for that particular discussion. I was there for the broader discussion around a risk stratification process for international arrivals, where how that assessment might be made was discussed.
And just on the 25-kilometre limit, the Premier said that it was a decision made on the best health advice available. Can you just clarify whether it was a decision made by the public health team or by the Premier's office?
No, it was public health advice. Yeah.
Professor Sutton, yesterday emails emerged that contradicted your testimony at the inquiry about what you knew and when on private security. Then yesterday, as we've just discussed, that you said you weren't at Monday's meeting with health experts where New Zealand travel was discussed. You said you weren't there on Monday, not that I can remember. It's now been revealed. You were there, you just weren't there for that specific part.
Correct.
How can Victorians have confidence in you, considering that your version of the truth, I suppose, keeps changing?
I think I've just responded to the question about not being at a meeting where a specific issue was discussed, so I hope that's settled. In relation to the emails, I've probably had 30,000 emails on coronavirus since this has started. I get up to 150 a day. I'm in copy for many of them. Many of them run to several pages. If I've missed a reference to security in late May when the program was established, I'm sorry. It hasn't registered. So when I've spoken to the inquiry to say exactly that, that was the case. I was never involved in the decision making around private security. I didn't get asked my opinion on it. I wasn't involved in the setup of the program, and I didn't have a command or control role. And as I said to the inquiry at the time, my public health team were trying to make a case for stronger oversight from the public health team, so I was keen.
The Commonwealth Health Department has confirmed you were there throughout the whole meeting on Monday and also on Tuesday.
So I wasn't there the whole time on a Monday. I think that's been made clear.
Convenient that you weren't there for that.
How can it be convenient? I think I was here.
Inconvenient, I suppose.
I think I was here prior to that meeting. I think I was going to my office from here at the time that it started, so I couldn't get there on time.
I suppose it's just in the last 2 days we've seen emails that you were part of that included private security. That's been such a critical issue in the whole hotel quarantine program. Now, you said yesterday you weren't there at this other really important meeting. Now we're hearing that you were there. It's just a bit hard to follow.
I wasn't there because I was here. I go to those meetings whenever I can make it. If I've got other commitments, my Secretariat support is there to note. I get that information at the end of every meeting. I think Alan Cheng was there for the entire meeting on the Monday. So, Victoria has representation. My deputy was there.
Premier, a question please
Sure.
on just the retail timeline.
I would have thought would have been much more convenient to be at the AHPPC meeting than here. But I don't get to go to AHPPC meetings, so maybe I'm not qualified to make that judgment.
The 1 November timeline,
Yes.
Retail, hospitality and personal care, what will the limits on those numbers be?
Can't give you,
customers?
things like beauty therapy, for instance, it'll be similar to the way it operates in regional Victoria, so provided you can wear a face mask. Things like in terms of hospo, so bars, cafes, restaurants, it'll be very much, I think, akin to the first step that we took in regional Victoria, so it'll be 20, could be 50, might be a bit less outside, but as soon as we can confirm that, we will, and that'll be the product of working with industry peaks and others around that. What was the third category, sorry?
Retail,
Retail.
hospitality,
Retail will
personal
be
care.
retail will be open, but there'll be a whole range of COVID-safe planning, and if we can move at a point to that sort of QR swipe thing, which many supermarkets and others are doing now, so you sort of touch on as you come into the venue. So we've got a pretty complete list of who was there and when, all of those sorts of things. Plus there'll be cleaning, and it'll look different, but it'll look relatively similar to what it did when it was open last time. So that's that's all to be determined. And I think as we've always had, we've always had conversations with industry about they know their workplaces better than we do. So I'm confident that will continue.
And just with regional businesses, sorry, can I just clarify, if you go visit a cafe and you sit down, the owner's required to take your details.
Correct.
Will that be the case for a retail store, like a shoe shop or, don't know, a hairdressing service?
Not yet finalised. It may be of great benefit to us if that's done. Now, I fully acknowledge that some settings that will be easier than others. Whether it's a shoe shop might be able to do the handwritten thing. Supermarkets obviously a bit more challenging, but that's why some of those retailers have actually moved to that kind of QR type arrangement.
Sorry, just to clarify on the hospitality answer you gave there. So if we're looking at,
Yes.
say, 20 to 50 people from November the 2nd outside, potentially at a pub, how does that square if you've got only sort of 10 people outside in a gathering from 2 households, but can I go to a pub then, with 20 people from 40
No,
different households?
there'll be group limits, so there's a maximum of 10. The party can't be any bigger than that. Look, I know this is a bit counterintuitive. We can't let you do certain things in your own home, but we can let you go and do it at a pub or a restaurant. The difference is, at the restaurant, someone's making sure that you keep your distance. Someone's making sure that the place is clean to that kind of industrial standard. There's a list. There's a kind of there's a formality to that whole environment that we all know. If we really think about it, and if we're completely honest with ourselves, you let your guard down. You've got people in your house. You're not keeping a distance. Of course you're not. It's not as safe. And I know that's a bit counterintuitive. Why can't I have X people to my house, but I can have Y people at at a cafe? One's regulated. One's regulated. One's licensed. One's got a structure and a formality to it. One's out in the open too, so we can see it and we can make sure that it's to the highest standard. And of course, private homes are very, very different.
And also the difference of people gathering outside though, is there as much of a difference in terms of the health risk for people, a group of 10 in a park versus a group of 10 in a beer garden when we get to that point?
No, and that's why it's a party of 10, a group of 10 at a pub, for instance, and that will be aligned with the public gathering number. But both of those could change over time. But again, what's worked in regional Victoria pretty well. We've gone from 20 now 40. And we've also increased the maximum number of people that are outside. Different square metre rules outside than inside because of obviously different environment, but we'll look to replicate that as much as we can. But we'll be talking to industry about that in some detail.
Thank you. So Professor Sutton just said that the Deputy Cho was at the AHPCC meeting.
Yes.
Do you maintain that Victoria wasn't informed that these Kiwis were arriving?
Well, again, we're back. Look, if AHPPC, so the group of Chief Health Officers, were the decision makers on this, then I don't know why I've been firing letters back and forth to the Prime Minister dealing with these very issues. I didn't delegate to a group of officials. I don't think the Prime Minister did either. Whatever happened there, I can't change that. None of us can change that. But I don't think it's unreasonable for us to be concerned if a whole bunch of people from another country turn up in Melbourne when we were of the view that we were not part of that arrangement. I'm not blaming anyone, I'm not finding fault, other than saying this. If we all get back into our corners and do that, blame each other, and some of the quotes that were, just put to me a moment ago, well then that won't fix it, will it? I don't want to be shutting our border, we won't be doing that. Who knows, we may have to be, in order to get this right and have it all transparent and so we've got knowledge of what's happening, we may have to join this bubble. We didn't want to do that because we're all pretty much focused on other things, but I tell you what, I don't know how many hours were spent last night. Police, public health people, authorised officers, ringing people, visiting people. Surely we can all do better than that. We've always tried to work as closely with the Commonwealth Government as possible. That's our aim. That's how you get the best outcomes. But anyway, let's just focus on getting this right. And we still have some people to visit on that list. We haven't actually seen all of them. That'll be happening now.
I apologise to you asked about this yesterday, Premier, but Your decision to appoint Jeremy Moore, how did you come to that decision?
I think he's the best person for the job.
How do you know if you didn't look outside your building?
Well, the long-standing custom and practice that the Premier of the day won't necessarily go and do, and well, certainly it's my standing practice, and I think it is broadly reflective of what's happened in other governments. We're not doing a global search. We need someone who knows the Victorian public service, who's got the qualifications and the experience. Jeremy's an outstanding Victorian. He's worked very hard in lots of different roles. He's made his way up through the public service, and I think there is no better person to play this role. I think he brings a unique perspective, and he's somebody that I think will do an outstanding job. If I didn't think that, then I wouldn't have appointed him.
You know, you started out as a journalist.
And I make no judgment about that.
Just putting it out there.
Just goes to show.
There's hope for all of us.
There's hope for all of us. There's hope for all of us. Now, I'm just seeing a message at the back here, right? There's a certain netball game that's starting. Now, I won't be watching it. I wish I had time to. I won't be doing that. But this has been a point of some concern, not for us not to cut across that. It's a very significant event. So if we can... Any other questions?
This just a quick one.
Sure.
What happens in future if tomorrow there's another plane load of New Zealanders arrives in Sydney? What happens? Are they not allowed to come to Victoria, or if they do, they're sent back? Or
No. Sorry, and maybe we've got a bit distracted, and maybe we've got off point. Maybe I've been responsible for that in some way. I've got no power to stop them coming here. Right? They will come. We'll speak with them, because hopefully we've got greater visibility of the fact they are coming. They won't just be lobbying. We'll know they're coming. We'll know they've transferred from an international flight at Sydney to a domestic flight that's coming to Melbourne. We may even finish up with that international flight coming to Melbourne from New Zealand, because that might just be the easiest way to go. And then we'll have a chat to each of those people when they arrive, and we'll make sure that they've got everything they need, they know what the rules are, and that they go about their business and they follow the rules. No one's alleging that the virus is high in New Zealand. It's not. What was concerning was that a bunch of people turned up and we didn't know about it. And then it turned out it's gone from 17 to 20 to 23 to now, 50 something, and we're still chasing some of these people down. And some people who we were told had arrived in Melbourne are not in Melbourne; they're in another state. And there's nothing more or less than that. But if there's any more people arrive, I think we can be confident that we'll be having a chat with them, and they'll be welcomed. It's just a matter of we have to go through a process and have visibility of who's coming. I don't think that's too much for us to ask.
Do you have a message to the New Zealand Prime Minister after her win last night?
I sent her a message last night. I sent her a text, and we were texting back and forth a bit. It's a fantastic victory for her, and I think it's a great moment for New Zealand that they've made such an emphatic choice. She's an outstanding person, a friend, someone that I regard very highly, and the people of New Zealand seem to share that view, in that she's been re-elected in unprecedented terms. This is perhaps the greatest majority that the New Zealand Labor Party is, or the greatest showing, the greatest level of support that the New Zealand Labor Party has ever had. We wish them well. Any more questions? If not, I'll be back here tomorrow, and I look forward to it.